Hey everyone, my name is Dr. Josh Stewart here at Stewart Sport and Spine Physical Therapy in Ankeny, Iowa. So I want to introduce you to one of my patients, and this is Sean. So Sean has quite the extensive history of low back pain. So he's had back pain for over 15 years. And in that time period, he's tried a couple different chiropractors, had formal physical therapy, had like warm water aquatic therapy, had multiple injections into his lower back, and also had a consultation with a spine surgeon. And thankfully, the spine surgeon determined that he was not a good candidate for surgery at that point in time. So what Sean was originally diagnosed with were multiple herniated discs in his lower back. And as you know by now, with respect to SI joint dysfunction, which is our specialty, it can mimic a lot of other low back pain pathology. So kind of like Sean was experiencing, it can give a radiating pain going down the back of your leg into the lower leg. So we're thinking more of like a sciatica or a pinched nerve in the lower back. And it can also present as pain kind of in the front of the hip into the groin and into the thigh, where we usually think that's caused by a hip joint pathology, okay? So Sean, before you came and saw us, what exactly were your symptoms? What were you feeling on a daily basis? And then what were some activities that were difficult for you to do?
Well, most of my symptoms were in my lower back and in my hips. I wasn't able to either stand for an extended period of time, sit for an extended period of time, basically hold any position without changing it up, without starting to really experience pain along that area. Even simple actions like bending over to tie my shoes, put on my socks, were very, very painful. And I'd have some pretty serious episodes where I would be incapacitated, not even able to walk for a few days.
Yeah. So obviously it was very much affecting his life through on a daily basis. So it's something that he really needed to get addressed. So the thing about SI joint dysfunction, as we said, it really can mimic a lot of other things, which makes it really challenging to diagnose and treat. But it also does not show up on x-rays or MRIs, just kind of adding another layer of complexity with respect to that. So specifically what Sean had, so the first thing he had, and these two usually go in combination with each other. So the first thing he had was what we call an upslip. So his right hip bone right here actually went up a little bit like that. And as you can see within this SI joint, there's a lot of jagged and sharp edges, which can create that compression and shearing force within the joint that can go down the leg or in the front of the thigh like we described earlier. So what we did is over a course of 8 weeks, we pulled this down manually, okay? And then we really worked on strengthening an outside hip muscle here and then stretching a hip muscle on the top of his hip to ultimately hold this down for a period of time, okay? And solve that issue. So the second thing that he had is called the sacral torsion. So this is your tailbone, so the base of your spine. What happened is Sean actually had a little bit of a rotation to the left side. So he had this right side up a little bit. So what we did over the course of the 8 weeks is we strengthened a specific muscle on the right side of the sacrum and re-rotated it so it wasn't kind of twisting like that. When people have sacral torsions, where they feel the pain is right here at the base of the spine, and it can actually even go all the way up into your mid-back, which Sean actually had a little bit of when we first started, okay? So like I tell all my patients when they first come in here, it's about a 5 to 8 week process. Men take a little bit longer than women just because we're not quite as flexible as women are. And then the second thing and the most important thing is when you're done with your treatment here, my goal is to never have to see you again. Because what I'm going to do is I'm going to educate you exactly, what is causing your pain, and most importantly, how can you fix it? So basically, if you have a flare-up somewhere down the line, a couple years down, you're going to know exactly what to do and go to correct this issue independently. So you don't have to spend money and come back and see me or anyone else like me ever again. So like I said, 5 to 8 week process, 5 exercises.